this pilot trial of 98 high bleeding risk patients who underwent percutaneous coronary intervention, or PCI, genotype-guided P2Y12 inhibitor monotherapy within 1 week appears safe and effective. My name is Brendan Ingram, and I'm an interventional cardiologist at Mayo Clinic in Rochester, Minnesota, and I specialize in coronary and peripheral interventions. I'm here to talk about the CHAMP trial and our paper published in the January 2025 issue of Mayo Clinic Proceedings entitled Genotype-Guided P2Y12 Inhibitor Monotherapy Within 7 Days of Percutaneous Coronary Intervention in High Bleed Risk Patients, the CHAMP trial, a pilot study and safety assessment. In this pilot trial of 98 high bleed risk patients undergoing PCI and prescribed ultra-short dual antiplatelet therapy, meaning less than 7 days, there was 1 possible stent thrombosis, 3 patients on clopidogrel had BARC3 bleeding events, and there were no deaths at 90-day follow-up. Shortening dual antiplatelet therapy in patients at elevated bleeding risk is an interest of many of us in our cath lab in the Department of Cardiovascular Medicine here at Mayo Clinic. Our stents and PCI techniques have come a long way, and we no longer need the degree of antiplatelet therapy that was once necessary. This strategy isn't appropriate for all patients, especially those at high risk for stent thrombosis, but many of our patients could benefit. We know that post-discharge bleeding after coronary stents is a big problem with significant morbidity and mortality in our aging population with multiple comorbidities. We're trying to tailor the antiplatelet intensity to the patient to balance bleeding and ischemic risks. One way we do this in the trial is using genotyping to determine which patients respond appropriately to clopidogrel, which is the generic name for Plavix. Approximately 2/3 of the population metabolize clopidogrel appropriately, and by identifying them, we can feel more comfortable using clopidogrel as a single antiplatelet therapy and eliminating the aspirin, thus reducing their bleeding risk. This also allows us to limit the use of prasugrel and ticagrelor, the more potent P2Y12 inhibitors, which are associated with more bleeding. For patients, we can help decrease your risk for bleeding, which often requires hospitalization, procedures, and transfusions, while also eliminating one of the multiple medications prescribed after a cardiac stent. When bleeding happens, there's an increased risk for death, so avoiding these events is very important. However, we don't want to increase the risk of the stents clotting and causing a heart attack, so having the right amount of blood thinner on board is very important. In our next line of research, we need to repeat the trial with more patients in a randomized fashion to hopefully show a statistically significant benefit to this strategy. We also need to investigate the optimal strategy for patients with STEMI and those on chronic anticoagulation, as these patients were excluded from the trial. Thank you for watching, and I hope you will read our article on early genotype-guided P2Y12 inhibitor monotherapy in high bleed risk patients post-PCI.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.